Hi, I'm Dr. Robert Hermann. Today I'm going to talk to you about spinal degeneration. Spinal degeneration goes by several different names: degenerative disc disease, degenerative joint disease, spondylosis, triple joint syndrome, arthritis. But spinal degeneration is not something that happens overnight. It is a process, a very slow process. So I'm going to explain this in 4 parts. The first part is what is normal. So this is a normal vertebrae. This is the vertebrae, and in between the vertebrae is a disc made of cartilage. In the back of the vertebrae we have the facet joints. These are joints here and here which interlock with the vertebrae above and below it. Inside the center of the disc is a ball of fluid called the nucleus pulposus. It is the job of the disc to keep that nucleus in the center of the vertebrae, and the function of that nucleus is to absorb shock. So when you were a kid and you jumped off your garage roof, all that force on the vertebrae or on your spine was absorbed by that nucleus and spread out evenly across the disc. So when you go to sleep at night, you lay down, and the artery does not have the disc does not have an artery that goes to it. The only way it gets its blood supply is when you lay down at night. That disc will swell. Fluid will go into the cell or into the disc, and that will bring nutrients which helps to nourish the disc. So when you lay down at night, everybody grows about a 1/4 inch, just because that will swell. When you stand up in the morning, you're about a 1/4 inch taller, and you'll squeeze some of that excess fluid out of the disc. That's why when you wake up in the morning, if you have a disc that's already a little bit swollen, it'll be a little more swollen. You'll have some pain and stiffness until your body weight squeezes some of that excess fluid out of there. So that's a normal disc. And I'm going to show you what happens when you have an injury. When you have an injury, the muscles that surround this joint will tighten up to try to protect the nerve that comes out, and just to splint this area so that you don't feel pain. Your body figures if you don't move it, you won't irritate it. So there's tightening in this joint. When you get the tightening, when you lay down at night, you don't get as much fluid into the disc, and the disc slowly starts to degenerate, and it'll get thinner. When the disc gets thinner, the 2 bones come closer together, and that leaves less room for the nerve to come out. You can also get a weakened disc and start to get tears in the disc. If you watch the video on fixation, it'll explain more about what happens when this tightens up.